Many people still perceive diabetes as an incurable condition that must be managed for life. However, with advances in understanding the pathogenesis of diabetes, reversing diabetes has become a clinical possibility. In 2016, Professor Domenico Achilli's team firstly confirmed the phenomenon of beta cell dedifferentiation in the pancreas of patients with type 2 diabetes. The differentiation can be understood as a form of dormancy that, under the long-term damage of high glucose toxicity, beta cells cease to function, losing their ability to secrete insulin and instead begin to secrete other hormones, without the cells themselves undergoing apoptosis. In 2017, the prestigious medical journal The Lancet published a significant study by Professor Roy Taylor on reversing type 2 diabetes. The study involved 306 participants, with nearly half of the intervention groups successfully reversing their diabetes. This experiment is considered a milestone in diabetes treatment, with the continuous accumulation of evidence-based medicines on type 2 diabetes. China's diabetes treatment guidelines have also been continuously updated. The China Type 2 Diabetes Prevention and Treatment Guidelines 2020 edition has removed the statement that type 2 diabetes is a lifelong medication disease. In September 2021, the expert consensus on the remission of type 2 diabetes in China, jointly released by Professor Ji Linong, Vice Chairperson of the International Diabetes Federation, and 23 other diabetes endocrinology experts from across the country, pointed out that dormant pancreatic beta cells can be awakened, and type 2 diabetes can be reversed. Clinical research results show that both through intensified lifestyle interventions, drug treatments, and metabolic surgery, it is possible to slow down the progression from prediabetes to diabetes or to reverse existing hyperglycemia to normal levels. So, when should patients attempt to reverse their diabetes for the highest probability of success? The answer is the earlier, the better. The duration of the disease is one of the key factors in determining whether diabetes can be alleviated. Type 2 diabetes patients who are younger and have a shorter duration of the disease are more likely to achieve remission. If the golden period is neglected and not intervened, allowing the pancreatic beta cells to fail, and when the function of the pancreatic beta cells gradually declines significantly, complications such as diabetic nephropathy and diabetic foot will occur, making it difficult to restore islet function and reverse diabetes. At that stage, ordinary lifestyle interventions no longer work, and one may ultimately face blindness, uremia, and have to pay more economic and time costs, and the pain to oneself will also intensify. Therefore, if you want to reverse diabetes, it is better to control blood glucose as early as possible, keeping fasting blood glucose, postprandial blood glucose, and glycated hemoglobin within the normal range, no longer allowing beta cells to be damaged by a high-sugar environment. At the same time, reduce visceral fat, alleviate insulin resistance and the lipotoxic effects of fat on islet cells, and take multiple measures to awaken the dormant pancreatic beta cells. Shijian Health's Type 2 Diabetes Remission Program starts with 5 core elements, combined with our independently developed series of blood glucose control products to bring the derailed sugar metabolism, lipid metabolism, and gastrointestinal function back on track, helping patients repair islet cells and stabilize blood glucose values, reversing diabetes. Controlling sugar and carbohydrate intake. Controlling the intake of sugar and carbohydrates in patients helps to exclude excessive sugar and carbohydrates, which is beneficial for controlling blood glucose levels and avoiding significant fluctuations in blood glucose values. Weight loss and fat reduction. About 2/3 of type 2 diabetes patients are overweight or obese. Scientific weight loss and fat reduction can correct obesity, fatty liver, and pancreatic fat. By controlling weight, the patient's islet function and insulin resistance will be greatly improved, and blood glucose can gradually become stable. Reshaping the gut microbiota. There is a close relationship between gut microbiota and diabetes. By repairing the gut microbiota, It can promote sugar and lipid metabolism, suppress corrupt bacteria and intestinal inflammation, and enhance insulin sensitivity, correcting insulin resistance. By combining aerobic exercise with resistance training, it can increase muscle volume, continuously improve insulin sensitivity, and directly consume excess sugar in the body, maintaining stable blood glucose. It also has a positive effect on blood lipids, blood pressure, and cardiovascular health, activating dormant islet beta cells under the long-term damage of high sugar, high fat, and chronic inflammation. Pancreatic beta cells lose their ability to secrete insulin and begin to secrete other hormones, without the cells themselves undergoing apoptosis. Through a scientific diabetes remission program, dormant beta cells can be awakened to secrete insulin again. No one wants to take injections and medications for life. Don't let diabetes control your life anymore. Join Qijian Health's Reverse Sugar Plan, guided by a nutritionist throughout, controlling product matching, nutritional intervention, reshaping the gut microbiota, and exercise metabolism, and other key links, so that you can take fewer detours and reverse type 2 diabetes together.